Hello and welcome to Chapter 2, Part 2 of our back pain presentation. The question for today is, how should we treat our back pain? And more importantly, what does good treatment look like? And then how do we know when we're getting good treatment, and how do we avoid bad treatment? This is a very, very important question, because you only have to look on social media to see thousands of people promoting this exercise, that treatment, and how do we as the general public go, that's good or that's bad? It's very, very difficult to do, not easy at all. So I'm trying to provide some guidelines here to try and help us. So firstly, how should we treat our back pain? Okay, so firstly, it is extremely important that you get a full assessment. This includes the following: a full medical case history, and in this case, a lower back case history. Secondly, we need to discover a movement screen. What movements hurt you? So the question should go something like this: please show me what movements hurt. So does putting on your shoes or socks in the first thing in the morning hurt? That is an important question and highlights as to where our clinical reasoning should be. Then there should be a complete assessment. Now, most therapists do not do this. If you are talking a complete McGill assessment, Stuart McGill reports that takes him 3 hours, and he is a world-leading expert, and it still takes him 3 hours to do a complete assessment. That's a pretty in-depth assessment. There should also be a discussion of any imaging, any MRI scans, any x-rays, and what can we learn from them. The solution, though, the solution that we're looking for people with back pain is, whatever we do, we have to dial down the pain sensitivities. Then, once that's happened, we gradually need to expand our pain-free repertoire of activities. We need to start where there isn't pain and repeat and gather strength and muscular endurance, and gradually over the weeks and months build that repertoire of pain-free activities and start doing things that previously hurt that now don't. Then, of course, we come to this big topic here. Historically, we've all been to physios, osteos, chiropractors, and massage therapists. Now, some of those I hold qualifications in and have been practicing for 25 years. And the first thing I would say to you is that sometimes, even if you do a PhD, even if you're doing a master's in some of these fields, some of the research that we learn is outdated and not up to date with the current scientific thinking. So you need to ask yourself, is this practitioner up to date? So the first thing to understand is all manual therapy is beneficial at some time in some places. And all manual therapy, whether you're clicking or cracking or stretching or massaging, creates a neurophysiological and immuno effect. So one such example of that is the so-called stretch reflex. You treat somebody, you invoke a stretch reflex, and it reduces pain. Now, here comes the crux of the problem. If you are specifically talking about a discogenic pain, when you have a discogenic pain, there is an unstable joint normally. Having a bulging disc, it creates a degree of instability. If I manipulate that joint to relieve the spasms that have happened and that are causing pain, there is a benefit in the short term of doing that. Getting that manipulation does relieve pain and spasm in the short term. But the problem is that you've actually made that segment more unstable in the long term, which means that the spasm is more likely to come back and you are more likely to have repeated effects of back pain. So we need to be careful in our thinking. So, we've said this already. In discogenic pain, the segments become unstable. The body creates spasm to protect the area. If you treat the area with stretching, massage techniques, etc., and induce a stretch reflex, it does relieve the spasm and it does produce pain. There is no argument about that. However, once again, we said, If the joint is unstable, in the long term, you are making it more unstable. That spasm exists because it's the body's way of stopping that hypermobile, unstable joint keep moving and damaging the tissue around it. So a poorly designed treatment program in the long term could make you worse. So you have to think, what am I actually doing here? What am I actually getting out of this? Let's see if we can make this hyperlink work, which we can't, so we'll come back to that. So what is good treatment? Well, what do I think is good treatment? So a good practitioner will do the following: a full case history, a full assessment, use manual therapies, acupuncture, manipulation, articulation, whatever it is that you want to do to reduce pain. But then they will provide some specific stability or flexibility activities, exercises to be done on a daily basis to deal with the unstable joint or the stiff joint accordingly to what is going on. So that completes chapter 2. Hopefully that's building on your education of what is good treatment and what is bad treatment. And hopefully you'll tune into chapter 3, where we will continue down this road and start actually looking at the practical things that you can do to help yourself.